888-3. Dr. Joe Congeni is on board with us, Sports Medicine Center, Akron Children's Hospital, and certainly a lot to talk to Dr. Joe about this morning. We always center in on sports medicine, and Dr. Joe, a bacterial infection with Leonys Martin of the Cleveland Indians. The word is almost took his life. He is recovering, stable condition. And you and I have talked, and I don't know what it is, but we've talked about staph infections and stuff in the past. This is really, really serious stuff.
Really serious stuff. Yeah, Ray. It, as everybody has said, it's definitely, is much more important than the game of baseball and everything. And they've kind of allowed a little information at a time almost each day. At the beginning, they gave us very little information about it, but it sounds like he got one of these overwhelming bacterial infections, which word thrown out. And what happens with sepsis is that this infection, this bacterial infection, usually sends out toxins, or from how serious this infection is, it leads to damage to end organs. And because Tito called it kind of an intestinal distress initially, I assume one of the organs was probably the intestinal tract. It could well have been the kidneys, the liver. They said several organs were at risk and were damaged initially by the infection, which is what sepsis is. Usually these infections a lot of times will spread into the bloodstream and then go to the end organ and damage them. Now, the deal is that if you get on antibiotics and appropriate treatment and you avoid the initial first few days, and they said he's out of the woods now, he was up around in his room, all really good news yesterday, is you can recover fairly quickly on antibiotics as far as all these things can be reversible, the damage to the organs. So you can recover from these very well, even being in the depths of where he was. But nobody yet is beginning to talk about anything about playing and things like that. And the problem with this sport, so much is timing, so much is conditioning, and every day that would go by that you'd spend in a hospital bed would be time away to make it more difficult that he would ever make it back this year.
Joe, this is the seriousness of, talk to me about how this bacteria gets into the bloodstream. You and I have talked about open wounds, whether it be from field turf or a scrape or something. Is that the only way it gets into the blood system?
No, Ray, it's very hard to know what way that it could have gotten into the bloodstream. There's very, very many ways how it got into the body. So it isn't just from open wounds and issues like that. It can be through the GI tract of things that you eat and other things. One that is very common that causes bad toxins, they haven't said which bacteria it is, but some people in taking a lot of antibiotics to fight other infections can get one type of bacterial infection that is really a dangerous one. Sometimes we never do know. So when Chris Antonetti and when Tito talk about, hey, we just do not know, it's absolutely true. The medical people may not know where this infection came from. I imagine soon they'll say which bacteria. They've not said, but you don't know where they really, for that period of the first 24, 48, 72 hours, can be life-threatening. And it sounds like right now, thank goodness, he's out of the woods. He's much improved. He continues to improve daily, so that what they use to fight the infection in the hospital, most likely and mainly antibiotics, seem to have got him headed in the right direction.
Joe, traditionally when you get an infection like this, what are some of the symptoms just for all of us to be aware of?
Well, obviously, one of the things that we look at are fevers, chills, one of the things, and again, I assume because of the thought that it was intestinal distress, that it can be really bad diarrhea, vomiting, and issues like that. If it affects the intestinal tract, if it affects the kidneys, you may see changes in your urine or changes in the ability to pee and things like that. And so it depends on what part of the body is affected first. But typically the general thing you'll see will be fevers, chills, and really feeling, malaise, definitely not feeling well at all and not able to do the regular activities of daily living. Those will be some of the hallmarks. And then it will be whatever organ system is affected by sepsis. Because, again, the definition of sepsis is end organ damage. So some of the organs in the body were affected by the infection for Leonys.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. We also found out last night, Joe, speaking of the Indians, stress fracture for Trevor Bauer after he got hit with that shot in the Chicago series against the White Sox.
Yeah.
We're not sure the extent of that, but with a stress fracture around the back of the ankle, is that minor? Is that major? Is it case by case? What can you tell us without seeing the x-rays?
Sure, without seeing the x-ray and knowing, but we see these exactly as this was described in our office too in younger athletes. So it was the fibula bone. Of all the bones, it's got the least important role. That's the skinny bone in the shin and the lower shin. We know that because you saw when he got hit. If you saw the live or the replay of it, it was on the outside of the ankle, and the small bone on the outside of the ankle, the fibula bone. So initial x-rays were negative. Remember, we were told in the first 24 to 48 hours. And then in continued symptoms or whatever other to know with bearing weight and issues like that, they were even talking about him starting Friday. They ended up having to do an MRI. And in getting an MRI, they probably saw a lot of edema. Initial report was they called it edema, and then they saw some micro fractures, which is really, they're using the term stress fracture, but in real specific terms, stress fractures are those that occur from overloading a bone over and over again from a lot of micro trauma. This is truly like a trauma. So too small to show up on an x-ray, but when you do a more specific test like an MRI, you can see these smaller micro fractures and a lot of swelling in the bone around it. So you know that it's what they're going to use the term really traumatic stress fracture. And so there's some healing that the body just has to do, and there's staying off of it. There's a lot of things that you can do in pool workouts and other as he starts to get some of the strength back and less pain. But the problem is we're sitting here today 7 weeks away from the playoffs, and he was in such a good groove. Again, I'll go back to this sport that you know so well, is one where timing is important, where routine is important. He was in such a good groove, such a good routine. One of the best pitchers in baseball, almost unhittable this year. He's definitely going to have to take several weeks off, and it'll take time to build that back up. And the real question mark becomes, as these often take 2 to 4, more like even 6 weeks, is he going to have enough time? That's going to be the issue in the month of September to get back in that good groove he was in.
Well, we've seen these bruises, deep thigh, leg, often occur when they foul the ball off their bones there in front. I remember a couple years ago, Mark Teixeira with the Yankees fouled one off, and he was done. Right. He was done for the season. I mean, hopefully we don't go down that road, but these type of things really can linger. This is more than just a week.
Muscle bruise. So this is in the bone itself. And so deep bruise in the bone. And then when they looked at the MRI, very specific test, to call it a stress fracture, micro fractures, smaller fractures that don't show up on x-ray. And so, the bone has to heal itself. And whereas in the muscle, there's some things we can do to try to speed that along, there are a few things we use in the bone, and I'm sure they're using everything that we have at our disposal to get rid of some of that swelling in the bone to try to speed up this healing time. But there will be healing time, there's no question, and then there will be conditioning time of trying to get back to the level of where he was at. And the timing is just not good at all for the Cleveland Indians at this point.
Great stuff this morning, Joe. Thanks for the insight. Appreciate it. We'll catch up with you next week.
All right, Ray. Thanks. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, giving us the lowdown, certainly on the bacterial infection situation with Leonis Martin of the Indians, and then the stress fracture for Trevor Bauer on that comebacker to the mound in the White Sox series.